We'll go now into the next item of the agenda. The agenda is structured around the establishment programme for the board. The next item will be Bill McCarthy's report on the status of the programme, and then each of the following items takes one aspect of the critical success factors of the programme and reports to the board to allow us to satisfy ourselves as to the assurance of progress with the development of those items. So, Bill, over to you, please, on the programme status.
Thank you, Chairman. This is the report that enables the board to take an overview of the progress in the development of ourselves in the commissioning system, and importantly that development is being carried out in a way which will give us the best chance to maximise benefits for patients, improving their outcomes and ensuring that we work together and in a very focused way to do that. The overall message is one of good and steady progress, Chair. And I particularly pick out one or two areas. I think Joe Wass will talk later about recruitment, and I think that is making good progress, in particular in Ian Dalton's Operations Directorate. Clinical Commission Group authorisation and development of commissioning support services is progressing to plan, and I know members of the board have had opportunities to be involved with some of that. I'd also highlight, I think, a very important piece of business that was conducted at the start of last week, which was a coming together of local governments nationally with the NHS nationally, I think for the first time, and expressing that through a public agreement which establishes that we will work together both nationally and locally in the interests of patients, and that will matter a lot in for a number of our patient groups. For example, people with dementia, frail older people who depend on a very strong working relationship between the services and local government and the NHS to ensure that their outcomes, their experience of care and opportunity to live as full a life as possible is really maximised. So I think that was important, and I know David and yourself were at that launch event. The board has asked us before about our own development and ensuring that as we bring our new teams along, that we're helping them to understand the focus on patient outcomes. And we've had, since we met last, 2 leadership forum events. So as we've been appointing senior people both in the National Support Centre and in the operational Directorate Outreach, those senior people have been coming together to work out together how we're going to cooperate and collaborate in the interests of patients and their outcomes. And I think both of those events were very successful. So I think that's strong progress, but I don't want to underplay in any way the very real risks and the challenges. We do take a prudent and serious approach to the risks, and if I step back, I think my advice to the board is it's some of those unglamorous areas. It's around getting our people coming on board, linked in with the provision of proper premises and the estates, linking all of those people together with effective information technology so that we can really work in a very collaborative way. It's those basic building blocks, when I step back, that I think are probably our highest risk over the coming months. And as I think we discussed last time, we're now kicking into the formal process of reviewing our state of readiness, and we'll talk about that informally in December before publishing our assessment of that at the February board meeting. So, promising. I think we're doing strong work as team across the board, but there are some very real risks and challenges we need to keep focused on.
Thank you, but nobody, I think, should underestimate the sheer scale of the venture upon which we're progressing. The extraordinary shift of responsibility, of setting up new organisations, of shifting staff, of developing new programmes, and actually living up to the board's expectations and aspirations for the new system. It's colossal. It's absolutely colossal, and there's an enormous amount of work that we're going to have to do before April, and a lot more work to do after April to guarantee its success. But let me bring in colleagues from the board. Ed.
Yeah, I mean, firstly, obviously, congratulations on making the progress that's being made. And it's David's 97 days to go in a way, and by the time we get to December, it will be 60 days to go. And you highlighted some of those slightly less glamorous issues of infrastructure. And if I do have an anxiety, it's actually some of those, as you say, around finance, around infrastructure, around technology. And I'm just interested in terms of between now and December, what the really clear milestones would be to execute in that period, and then perhaps when we get to the December board to see the residual actions that are necessary, so that we can really assess in some detail how we get these from being anxious risks through to completion.
Yeah, I completely accept that analysis. I think that's exactly right. What we're doing as part of the state of readiness, and that's what we'll bring to the board, is to identify some absolutely critical deliverables which will be, signals of the broader health. So, for example, Joe's working on recruitment to see that actually the time is in diaries to just do the appointments. A really good lead indicator. On the IT provision, it's about the order. So we've already put in our first order for over 1,000 pieces of kit that will then be located, across the offices that Ian's teams in particular will be populated. So it's getting down to that level of granularity, which we're doing underneath this programme, and I'm very happy to bring some of that detail back next time, or in between times, if that's helpful.
Thank you, Bill. Other comments? Nagib.
Right. If you look at the progress across all these different areas, how would you characterise the kind of pace of progress? Accelerating, stable, halting somewhere? Give us a sense of, evolution over the last month.
Yeah, I think progress is accelerating. My caveat to that is it needs to. So it's not a straight line progression, the building of the board and its functions. As we move through, we've got a multiplier effect, for example, in recruitment. So, for every one person you recruit at a senior level, the next step on will be 5 or 6 more to be recruited. So we have to see that acceleration, and that is what we're seeing. But I don't want that acceleration to be taken to let anyone for 1 minute take comfort and ease from it. We absolutely need that acceleration over the coming period, but we are achieving it at the moment.
Well, thank you very much, Bill. We are invited as a board to note the current progress with delivery of the programme and to note the latest iteration of the business assurance framework and plans for further development. We're content to do that? We are. Thank you very much. Let's then move on to agenda item 5, which is the programme critical success factor number 1, safe transfer of functions. And I'd like to invite Jane Cummings, Chief Nursing Officer, to introduce her paper on nursing with midwifery and caregivers vision and strategy. Jane.
Thank you, Chair. This is currently in the process of engagement. So we are actually talking to nurses, midwives, patients and staff all up and down the country about it. But what I wanted to do today was just give a little bit of context to the paper, to describe a little bit about how we've got to where we are. What's really important, both to me personally and to the people I've been talking to, and to get some views from the board in terms of where we are and where we want to go. So I'd start off, I think, by saying that to be a nurse or a midwife is a huge privilege, and we care for patients from antenatal period through to birth, every stage of life until death. It is an amazing privilege. We talk and treat people when they are at their most vulnerable, and are the only professions that actually are with people 24 hours a day, 7 days a week. And I think what comes with that is a huge responsibility as well. And the care that patients receive, the way in which that care is delivered, and how they either leave that treatment or they move on into whatever happens to them next will never go away. And I'm sure if I spoke to every one of you individually, you would be able to describe care that either yourself or families have had. And for me, being a nurse was something that I wanted to do from not a child, but certainly from when I was a teenager, when my mum was in and out of hospital a lot. That has been reinforced throughout my nursing career. And for me, actually making sure that what we do is something that is truly memorable in the right way is where my passion for doing this strategy comes from. So on a very personal level, when my husband died 6 years ago, the care that he received and the ability I had to treat him at home, I will always remember. And I want everybody to have that same sort of experience if and when it comes to them. I want us to make sure that we can, in the vast majority of times, give the really best of care to the patients that we serve. And so this started off this vision started as part of my appointments process. Some of you will know that I went through a fairly long process to get the job. But part of that process was presenting to 50 frontline nurses, midwives, community staff about what my vision for nursing was. And I sat in this very room and described what I thought we should do, where I thought we should go, and actually got very positive feedback from those 50 staff. As a result of that, we've developed this vision with nurses up and down the country, and I had a big stakeholder event in July with about 50 top nursing midwifery leaders from education, from commissioning, from provision, from the Department of Health, from the National Trust Development Agency, etc. So this is something that's come not only from me as CNO for England, but also from the people that I work with up and down the country, and that's been really important. We've got a shared purpose, which we've described in this draft strategy as maximising our contribution to high quality, compassionate care, and the ability to deliver good health and wellbeing outcomes. So looking at the whole perspective of the work that we do. And the vision, as you will know from the document, has been characterised by 6 C's. And we identified those as being care, compassion, competence, communication, courage, and commitment. And they are deliberately simple, but they're very memorable, and they've got a lot of traction with people out in the service who work with patients on a day-to-day basis. They're also applicable to any sector. So wherever you work and wherever patients are cared for, those 6 C's can really make a difference. But as part of this vision, it's all very well to have 6 C's and to have those words, and we've got hundreds of quotes from nurses and midwives where they've described what those 6 C's mean to them individually. And some of those quotes are brilliant, some of them are written in the document, and we've got a lot more that we can use. But you need to have action to support, and we want to have action to support the delivery of those 6 C's. Culture, leadership, behaviour, style, the environment in which people work is all critical to delivering those 6 C's. So the next part of the strategy has identified what we think at the moment are the 6 key areas of action where we think that we'll have the biggest impact in terms of the ability to deliver those 6 C's. And you will have seen what they are, but if I just pick a couple of those 6. The first one is around helping people to stay independent, and that's about the public health agenda. It's about making sure that we all, in every contact we have, maximise people's ability to stay as well as they can and as independent as they can. Concentrating on the patient experience of care is so critical. If we can get that experience of care right, and patients can, and their loved ones can go home from hospital or can be from their community service or wherever community setting, wherever they're being cared for, if they have a positive experience of care alongside competent technical care, then actually we'll have achieved a significant amount. But the other key thing with that is actually supporting our staff. It's hard work being a nurse. It's emotionally draining. It can be very difficult a lot of the time. We need to create an environment which enables people to give the very best they can. And so part of the strategy, we've got 2 key work streams that look at having the right staff with the right skills and experience, education and training in place, the right values, but also how we improve their experience, how we give them the support and the supervision and the time to do their job properly. So part of the strategy at the moment is engaging with people up and down the country, just testing out whether the ideas we've got so far are the right ones and whether they've got anything else that they want to add. As part of the engagement, we have spent weeks having lots and lots of face-to-face meetings, having conferences, events. I'm holding webinars, WebExes, where we've had people from all over the country coming in. I've written articles in the nursing press. I'm now tweeting. I have to say I'm not the best Twitterer or tweeter that you can have, but I do tweet. We're holding tweet chats at 8 o'clock on Thursday evenings, which are having amazing impact with lots of people engaged. I've written blogs, I've done podcasts, and there's also been a lot of local engagement. So we've had local teams talking in their local health communities, directors of nursing, trust boards, talking about this locally. One of the things I think really important is is every board taking some responsibility to look at this and how it impacts on the care and the area that they work in. We've also worked with patient groups like Patients Association, National Voices to get their views as well. And we're asking people to give us feedback in a variety of different mechanisms. And as of this morning, just checked, the latest set of numbers of people we've either directly engaged with or have written to us with views is nearly 7,000. So, it is significant, and we are expecting to see a lot more in the next week before we finish our consultation. So in terms of where we are now, next steps is we're collating all of the feedback. The key for us is then to determine exactly what actions we take, what is possible, and if we don't know what's possible, what we need to do in order to get to the point where we can identify whether it is or not. The fact that identifying what success will look like, on a very superficial level but a very important level, I would say what success looks like is what our patients tell us of the care that they receive and what our staff tell us about how they feel about where they work and what their ability to give a good job. And we will also be looking for very transparent measures of quality and outcomes and experience, so we can be very clear both to our patients and staff but also to the public we serve what's happening. We are going to revise the document and we'll launch it. We want to launch it at the 4th and 5th of December when we've got a conference for senior nurses. And after that, we would have a very detailed plan of engagement, which will involve other key stakeholders like Health Education England, like the Department of Health. This is not just the commissioning board. This is a joint strategy for those of us that are responsible for leading nurses and midwifery. So my aim, as I said, is to build on this culture of compassionate care, to really maximise health and well-being, and to maximise the contribution that the healthcare professionals, particularly nurses and midwives, can play to delivering that. It's so important for our patients and for delivering exactly what we want to do, which is the best possible outcomes and prioritising patients in the work that we do. So they're a very quick overview, Chair, but happy to take any questions.
Thank you, Jane, both for the paper and for that very inspiring presentation. Let me invite comments from colleagues on the board. Victor.
Very, very good, very good vision. I was just interested in how will you know when we've got there? How will we, is there a sense of plateau? Where will we? What will be the indicators that we've arrived at somewhere different from where we are now?
I think, well, at the moment we've got some benchmark in terms of what patients and staff tell us about how they feel about the service, about the care they give. I'd like to see that improved. I would love us to be in a position where we don't have some of the horror stories that we've seen around care. I'd like us to be in a position where we can evidence that the things that we think are important have been implemented and that we're able to look at the improvements or the outcomes as a result of that. Some of this will be quite difficult to evidence. It is quite hard to measure compassionate care. We've done some research into that at the moment. It's the one feedback we had, is that actually tying down exactly how you measure compassion is quite difficult because it is very subjective. But if people feel that they're treated with dignity and respect, that they are able to report, that they can communicate with staff, that they felt listened and understood what they needed and provided them with support and guidance to find their way through the myriad of health and social care that is out there at the moment, I think we'll have achieved something. And of course, I would say, wouldn't I? I'd love to see less negative publicity around the profession and the care that patients receive. Difficult to do, and we still need to do more work on it, but it's really important.
Myra.
Any ideas, welcome.
Thanks, Malcolm. And I too like the 6 C's. I think it's great to have something that's simple and memorable. But a few comments really. I think it will be very important for the private and local government sector to be engaged, because again, I think there's something about those variety of employers that matter. And that brings me to my second point, really, because slightly I think it's about the way that it's written. The implication, I think, might be that this is all for nurses, midwives and caregivers to do themselves, but actually employers have very, very big responsibility here, and maybe distinguishing, you know, what makes a good employer that creates the environment for those people to work in. And I think there's a challenge again for us, and that, it's, obviously Jane has a special responsibility as the chief nurse, but the commissioning board wants to work in a different way with the whole sector, really, and it isn't a telling job, it's a supporting and influencing and helping job. And I think it will be an opportunity to demonstrate that new, more supportive, still challenging, but more supportive way of working.
Absolutely right. The work we're doing with local government and social care, absolutely critical. And I absolutely agree with you. This is not just about the individual nurses and midwives, caregivers doing things differently or even being told what to do. One of the benefits, I think, of the way we've approached the development of the strategy is because we've engaged with people as we've been going along. There feels, to a greater extent, some ownership that people feel. This doesn't feel, to many people anyway, that it's a top-down, you must do this. But we need to be able to, collectively, as a group of leaders, be able to put the systems and support and enablers in place to allow this work to get in place, to allow people to flourish and to be able to implement things that we know and they know are the right things to do.
I think Chairman, what we need to do when you finished your engagement process and you're coming to a conclusion is, we as a board need to then be pretty crisp and clear about what we are going to do about it. What are the kind of actions that we can take that will help? Because right from, we have an interest in the quality of the work that employers do in this regard. We know that well-motivated, happy staff result in better outcomes for patients. So it's important to us that whatever relationships we create, we reinforce all of that. I think we've got particular responsibility in relation to the Leadership Academy to support and help frontline leadership in nursing, to encourage and support them and develop them, and top-level leadership as well through all of that process. I think we've got a responsibility in relation to the improvement body about how we use that capacity to help and support nurses do their jobs better. And I think we have a big responsibility in relation to the way in which we design the kind of incentives and things in the system. So what we measure is important. So making sure we get to measure the right things so that we're responsible both for the patient survey and the staff survey. So how we design those questions, how we measure those things as we go through. So I think some really very concrete things that the board can do to help and support that. And I think we need to see an implementation set up when you finished your process and you've got that.
Absolutely. Nagi.
Now, I too was very taken by the 6 C's and your presentation. I had 2 comments really. One is that in propagating this, I think we need to look at how it can be written in a more accessible language, more simply, so that people read it and it doesn't feel like a planning document, but actually it's something that people would read and incorporate in their day-to-day work. And the other thing is, if we think the 6 C's are the right thing, to see them repeated in different contexts so that those become principles that people are widely familiar with, including potentially using them in patient surveys so that we get patients' views on whether they're perceiving in those domains of assessing the nursing care they get, whether they recognise those 6 and how they rate them.
Yeah, No, I think that is really helpful. And some of the feedback we've had as through the engagement process so far has been a view that, of course, the care that patients get and the quality of care that patients get is not just down to nurses and midwives and caregivers. It is a team effort. There are other healthcare professionals, there are managers, there are portering staff, everybody has an impact on patients, both in and out of hospital. So it is important, and lots of people have said the 6 Cs are as relevant to allied health professionals, doctors, managers, as they are to nurses and midwives. And I think that is probably true. We've also talked about how we can build those 6 Cs into patient feedback, but also into how staff, maybe, for example, staff appraisal, 360 feedback, that type of thing. And that, again, has come from staff as being something that they think would be quite a good way of looking at both culture and behaviour and support. So I think there are some really good opportunities that we've got, and that's helpful comments. Thanks, Nagib.
Ed?
Just one very quick one following Nagib's point, but to the other end. How quickly would it take to get the 6 Cs embedded in the curriculum of all nursing education in universities, in colleges and stuff? I mean, is it something that just can be done, or is it a long-term process?
I don't know how quickly it could be done. Certainly we've had the Council of Deans have been involved in the development of the work, and Health Education England and the Director of Nursing in Health Education England is also an active participant in us in terms of developing the work. I've presented this vision to hundreds of student nurses, student midwives and lecturers, practitioners and deans, and they like it, they get it. So on one level it would be relatively straightforward. We'd have to look at how the curriculum was developed, probably through the Nursing Midwifery Council. So there'll be some significant detail to go through, but the principle we could certainly pursue.
Certainly encourage it.
Thank you, Jim. I mean, I sense that we are at the beginning of a very significant piece of work. Your role as Chief Nursing Officer gives you professional leadership across a workforce of hundreds of thousands. But this spreads much wider than the nursing profession. I'm quite taken by your reported response rate of 7,000 people already. The document can't be too defective if it's generated that. So how much more effective it will be if we carry on working both on its articulation but also on its implementation. And I think we would take up all of the ideas that have been voiced by our Chief Executive about how the board can organise itself behind this strategy and ensure the success factors that you've mentioned to us. The board is invited to receive the vision and strategy and to approve the launch at the meeting on the 4th of December at the Chief Nursing Officers Conference. I take it we're happy to do that. Thank you very much.